Okay, let's talk a little bit about fluids and edema in the body. Most the body is made up of liquid and fluid, water. It's found in just the regular tissues and cells. Well, cells first that make up tissues and then make up organs and then make up the system. Within that fluid, it's blood cells. There's red blood cells, white blood cells, the cells of the different tissues. Within there, there's plasma and the plasma proteins such as albumin and platelets. There are electrolytes such as sodium and potassium, and the nutrients such as glucose, and then our waste products, which is some hydrogen ions, lactic acid, and such as from metabolism. Fluids usually move between the cell membranes and capillaries. Through these very thin wall membranes, fluids move across them because they move to equalize the concentration, so they would just passively move. These forces include osmosis. Hydrostatic pressure is where the blood pressure is forcing the fluid through the membrane, and then our oncotic pressures are the larger molecules that sit inside the vessel or outside in the tissue that draw these fluids from an area of higher concentrations to lower concentrations and the like. So they constantly keep this balance. One special consideration we'll talk about as we go through the slides is the active or facilitated transport. This moves a molecule, usually like water or other electrolytes, from a concentration of lower to higher, and we'll talk about something like the sodium potassium pump, which helps to exchange sodium and potassium as we move into electrical conduction and action potential. Here's a just big overview of intracellular. That means that most of the fluids within those cells, and then your extracellular, you can see that that's where we're looking at the vascular fluid and fluid within the tissues, fluid in the vessels and fluid within the tissues. And the fluid within your vessels, your blood vessels here, and then very little amount here within the cerebrospinal fluid. So most of it lies outside of the vascular space. This allows us to then draw certain fluids and blood supply from what we call reservoirs, and that we can see in patients of shock, where their skin becomes pale, cool, and diaphoretic, and we're shunting the blood from the skin, from the peripheral tissue towards the core, and hopefully increasing this intravascular fluid. Again, it's just we're shunting those blood vessels. It's not drawing necessarily fluid from that cell. Over time, it will cause this movement called osmosis. So here we would see as this blood volume here within our vascular space changes, or fluids from the cell can be brought in, and from the tissue spaces can be brought in through this capillary network here, and its ability to allow fluid to exchange from a lower concentration. If the person's in shock, it would be lower volume here, higher volume out here in the tissues and cells, and allow us to draw some of it back in. It would work in reverse if the person was edematous, as the fluid would increase in here and then force its way out into the tissue or into interstitial space. Hydrostatic pressure is shown here, where blood pressure, blood flow comes from the systemic arterial side, cross over the capillary and onto the venous side. As we see, the hydrostatic pressure forces the fluid out through the capillary membrane. It's allowed to exchange nutrients, and other byproducts are then returned back in. As the fluid goes out, the amount of concentrated molecules are less, it becomes more dilute. And inside the vascular space here, most of the water has left it and left the larger molecules in here. And so we have this kind of drawing of fluid that goes back and forth Fluid wants to shift from higher concentration to lower concentration to equalize. We'll take a look at this next slide to see the difference. Here you see that there are a lot more molecules on one side. These molecules are much bigger, and they affect their forces onto what you're seeing here. This kind of pink stuff is volume or fluid. And when these molecules here want to sort of equalize or stabilize the amount of fluid required, it'll draw the fluid across. And that's that oncotic pressure. So hydrostatic pressure is the systemic pressure from the arterial side. And then this is our osmotic pressure and oncotic pressure. Osmosis and oncotic pressure is drawing fluid to equalize. And now you can see in this picture here, the molecules are a lot more. This membrane is not allowing these larger molecules to pass across this cell membrane, but it did equalize. So for, let's say 2 or 3 of these molecules, it takes 10 cc's. If you could imagine, then 2 or 3 of these then would force the 10 cc's across. And what you're seeing is now they're evenly displaced, whereas they were highly concentrated here. So we can just imagine if this was the cell membrane of a cell. If this is the normal cell, everything is equalized minus these larger molecules. We'll take a look. The normal cell should be nice and round. This is a blood cell, red blood cell. Its volume on the inside is not being exerted anywhere on the outside or being forced out. Here you see hypertonic. The cell became shriveled out because the water now is leaving this red blood cell to mix with the sodium that's on the outside in the vascular space. So all that plasma is higher in concentration of sodium than it would be in the cell, and it's causing the water then to leak out. Hypertonic solution causes crenation or shrinking of your red blood cell. Our isotonic, go back to our normal saline concentration, keeps it within its normal shape. And if we give something sort of like D5W, glucose, that type of solution, will cause the cell, then the water and sugar to expand the cell membrane, causing these cells to be hypotonic, and the sodium level is changed, causing the cell to lyse and rupture. Now, if you just go back to the few slides before, and we're talking about edema, where we have swelling, here we show a bilateral edema quite large to this lower extremity. We have the hydrostatic pressure that pushes against the vessel, a little different from this one here. More fluids coming out your hydrostatic pressure. We're getting larger molecules that's similar to this, where they situate themselves outside of that vascular space, and the fluid then does not return back in to the vascular space, leaving that tissue edematous and swollen. Some of this tissue is also supposed to be drained through what's called the lymphatic system. Again, the hydrostatic pressure, large pressure force, forcing the fluid out. The molecules on the outside in the interstitial space within the cells and in the tissue are also causing this shift of water and fluid to create this edematous state. Again, most of the fluid is in your cells. It's in the tissues, and it can be found also within the tissue space or the interstitial spaces. There are some volume that lies within the vascular space and in the cerebral spinal space. Most of blood is made out of blood cells, red blood cells, white blood cells. There's some plasma and plasma proteins, and there are electrolytes, nutrients, and waste. Fluids move between cell membranes and capillaries to maintain that equilibrium or homeostasis. The forces on fluid, usually it's osmosis to keep that concentration of fluid at a balance, but we can have that fluid being pushed out of the vessels, and we can have oncotic pressure pushing it or drawing it depending on what side is more concentrated. And lastly, this facilitated transport moves molecules from a lower concentration, so it should be it should be moving against that. It should, normally it wants to equalize. So if it's lower, it should draw that type of molecule or chemical in. So this special consideration is called active or facilitated transport, where it's taking it from the lower concentration and moving it back to the higher concentration. We're going to see something like our sodium potassium pump.